Hello friends, welcome to my channel Pharmacology Insider. So, those who are new, please subscribe my channel and hit the bell icon for the updates related to pharmacology content.
Hello friends, today we are going to discuss about thyroid disorder and its treatment. So, myself Dr. Nilay Solanki, working in Ramanbhai Patel College of Pharmacy. So welcome to my channel Pharmacology Insider. Please subscribe my channel for latest updates. So first of all, we will be discussing about the synthesis, storage and metabolism and the secretion of the thyroid hormone. Okay, so first point is this. Now in this process there are main steps involved in the synthesis, storage, metabolism and secretion of thyroid hormone are uptake of the plasma iodide by thyroid follicle cells, oxidation of the iodide and iodination of the tyrosine residue of the thyroglobulin and secretion of the thyroid hormone. Okay, so this thyroid gland, when we say about its anatomy and physiology, it is a single layer of the epithelium and it is filled with different colloidal tissue inside. And when we talking about the release of this thyroid hormone T4 and T3, so it is mainly controlled with the help of hypothalamus and anterior pituitary gland. So initially hypothalamus is causing release of this thyroid releasing hormone, which is affecting the anterior pituitary gland inside our brain, which further releases the TSH, thyroid stimulating hormone, which is causing stimulation of the thyroid gland for the further release of T3 and T4. Now T3 is about 10% and T4 is about 90% in the thyroid gland. So they are retrieved from tyrosyl residue of the protein thyroglobulin. So this is the very much important protein for the synthesis of the T3 and T4. So this is regarding synthesis, storage, metabolism and secretion of the thyroid hormone. Now into that further, the regulation of the thyroid function, it is controlled by several factors and several mechanism is involved. So here you are observing the thyroid follicle epithelial cell. Now here there is one important component involved, which is called as the iodine transport mechanism, which is a energy dependent process. So whatever the iodine molecule is there, with the help of sodium iodide symporter, when it enters into the thyroid follicle epithelial cell, and then when it releases at the follicle lumen, or it enters into the lumen, it is converted into the iodine. Now here this thyroglobulin protein is already present in the thyroid follicle epithelial cell, which is a large number of tyrosine amino acid, which becomes thyroid hormone molecule after the complex formation. So this iodine and this thyroglobulin Tg, when it combines, it will form this complex. So this overall mechanism is called as iodination and coupling mechanism with the help of one specific enzyme, which is called as a thyroperoxidase. Now in the absence of this enzyme, this complex is not formed and further thyroid hormones are not generated. So this complex is converted into T3 and T4 complexes, where there is a molecule of MIT and DIT are also there. MIT is monoiodine tyrosine and DIT is diiodotyrosine. Now whenever this complex is internalized, further endocytosis coupled with Tg, this complex is further liberated, or you can say that the lysosomal degradation of this enzyme, which is causing the release of this thyroid hormone, where 90% is of T4 and 10% is of T3 thyroid hormone, while the remaining MIT and DIT, they are further converted into the iodine molecule, right? Now this hormone is further released into the plasma bloodstream for the overall regulation of the various functions related with the thyroid gland. So this is the overall regulation and mechanism of the thyroid hormone and its function. Now we will discuss about the types of thyroid disease. So the first important thyroid disease or disorder, that is hypothyroidism, where insufficiency of the thyroid hormone production, and it is a common cause of the hypothyroidism linked with the Hashimoto thyroiditis. While hyperthyroidism, where gland produces excessive amount of the thyroid hormone, and it is a common cause for Graves' disease. While thyroiditis, it is autoimmune Hashimoto thyroiditis and linked with the postpartum thyroiditis also. While the emergency conditions are called as a thyroid storm and mixed edema coma. So this is regarding the major condition related with the thyroid disorders or the disease. Now we will focus on to the pathophysiology of the hyperthyroidism. Now in hyperthyroidism, there is a loss of the normal regulatory control of the thyroid hormone and its secretion, and which is causing stimulation of the TH on the body leads to the hypermetabolism, which is causing a rise into the sympathetic nervous system. SNS activity is increased, and ultimately there is an alteration of the secretion and the metabolism of the hypothalamic, pituitary and gonadal hormones. Now excess amount of these thyroid hormones stimulate the cardiac system and increase the adrenergic receptor also. So overall these effects are called as a cardiac effects, where tachycardia, increased cardiac output, stroke volume, adrenergic responsiveness and peripheral blood flow alterations are there, which is ultimately linked with the negative nitrogen balance, and lipid depletion and nutrition deficiency is also observed. So all these things is ultimately leads to hyperthyroidism. So this is in brief pathophysiology of the hyperthyroidism. Now in case of the hypothyroidism, due to Hashimoto thyroiditis, which is one of the causative factor, and lymphocytic infiltration of the thyroid gland or the thyroid hormone, germinal center formation occur, and the atrophy of these thyroid follicles. Now atrophy is one of the major cell adaptation process, and accompanied by the absence of colloid and mild to moderate fibrosis occur inside the tissue, and as a result of that there is atrophic thyroiditis, and the fibrosis is much more extensive. Along with that, lymphocyte infiltration is less pronounced, which leads to hypothyroidism. So this is in brief pathophysiology of the hypothyroidism. Now we will be focusing on the main part of our topic, that is pharmacological actions of the thyroid hormone T3 and T4. Now the major action of this hormone is on the growth and the development. So first one is T3 and T4, they act on almost every cell of the body, and the growth related action link with the increase in the basic metabolic rate or basal metabolic rate, protein synthesis and regulation of the long bone growth. So ultimately this hormone is also coordinating with the growth hormone also for the growth of the bone system, as well as a maturation of the neural system, and increase body sensitivity towards the catecholamines, which are one of the major amines or the neurotransmitters. While in case of the metabolism related function, which is the second most important function, where lipid metabolism, and there is a role of the thyroid hormone T3 and T4 enhances the lipolysis by potentiating the catecholamines and the other lipolytic hormone, and by suppressing the phosphodiesterase, which is one of the major enzyme, and ultimately it increases the cyclic AMP formation, and as a result of that plasma free fatty acid levels are elevated. So free fatty acid levels increased, which is helpful in the lipid metabolism. While in carbohydrate metabolism, the utilization of the sugar by the tissue is also increased, and glycogenolysis and gluconeogenesis in liver, and the faster absorption of the glucose from the intestine, which is one of the major metabolism related functions related with the carbohydrate. Now in case of the protein metabolism, synthesis of the protein is increased, and prolonged action resulted into the negative nitrogen balance and ultimately there is a tissue wasting. Now because of the tissue wasting, there is a weight loss occurs, which is one of the major concern in the hyperthyroidism. Now the third important action related with the thyroid hormone, that is sclerogenesis. Now T3 and T4, which increases the BMR, which stimulate the cell metabolism and reset the energy state, which is important for maintaining the body temperature also. Then the four important pharmacological action, that is cardiovascular effects. Now here the heart rate, contractility and the output is increased with the help of T3 and T4, which also stimulate the heart by directly acting on the contractile element. Now here the contractile element, it is linked with the increased myosin activity, which is a calcium ATPase dependent activity by regulating the beta receptor. So this is the overall mechanism by which it stimulates the heart. Then fifth major action related with the nervous system, it has a profound functional effect on the CNS. Mental retardation is also observed in cretinism, while behavioral features are also seen in mixed edema. And hyperthyroid person, they are also anxious in nature, they are nervous as well as they are excitable. While in case of the action related with GIT and kidney, where the effect on the gut wall is increased by T3 and T4, and they generally do not cause diuresis in euthyroid individual, and the flow of the urine can be enhanced when mixed edema patient treated with the drugs. So this is related with the kidney and GIT effects. They do have the effect on reproduction, where T3 and T4 having indirect action on the reproduction. Fertility is impaired in hypothyroidism cases, and women suffer from the oligomenorrhea, so which is one of the negative point. And the normal function is for maintaining the pregnancy and lactation, which is one of the important component in reproduction for thyroid hormone. Okay, so now we will be discussing about the mechanism of action of the thyroid hormone. So there are two types of mechanism of action. One is genomic action. So here you can see that this is the cytoplasmic cell on which, on the nuclear receptor, the thyroid receptor, they are present on the DNA. Now whenever the target cell is affected by this thyroid hormone T3 and T4, and it binds to the nuclear receptor, as a response of that, the lipophilic T3 binds to the receptor and form the complex. Now this complex binds to DNA of the specific thyroid receptor, and as a result of that, there is an alteration of the transcription gene, which ultimately affect the mRNA function also, and ultimately the protein synthesis is also got altered. So this is about the overall mechanism and related effects of the thyroid hormone. Now the second important mechanism linked with the thyroid hormone, that is non-genomic action, and it is also linked with the CAMP mediated event also. Now TSH stimulated event at the thyroid gland, where the non-genomic action of the thyroid hormone, interaction between the component of CAMP, phosphatidylinositol and protein kinases were observed. Now here the important mechanism which are associated are the sodium iodide importer activity, thyroglobulin synthesis, thyroperoxidase synthesis, hormone synthesis, and endocytosis and hydrolysis and colloidal and the hormone secretion. While the deiodinase activity and hypertrophy, they are also related with the non-genomic cyclic AMP mediated events, which is linked with the thyroid hormone functioning. Okay, so now we will be discussing about the classification of the drug used in the treatment of hyperthyroidism and the hypothyroidism. Now in case of the hyperthyroidism, the drugs are the radioiodine compounds, thiouracils, they are also called as a thionamides, where Carbimazole and Propylthiouracil are the example, and sometimes iodine is also useful in the hyperthyroidism cases. Well, in case of the hypothyroidism, Levothyroxine and Liothyronine, these are the two major compounds, and the mixture of these two compounds, they are also used in case of the hypothyroidism. So looking into the individual drug where radioiodine, which is the first line therapy for the hypothyroidism, and here this I-131 isotope, which are emitting beta and gamma rays, which is one of the mechanism of these compounds. Now these beta rays, they are having a short range and they are absorbed by the tissue, and ultimately they produce the cytotoxic action to the cell of the thyroid follicles, and ultimately as a result of that there is a significant destruction of the tissue, which is required in case of the hyperthyroidism, because in hyperthyroidism the overall tissue volume and the cell volume is also increased. And this I-131 component of the radioiodine has a half-life of 8 days, and sometimes there is a hypothyroidism eventually occur as a treatment with this radioiodine compound. They are generally avoided in children's and the pregnant women because of the side effect profile. Then the second important drug therapy in hyperthyroidism, that is thioureulines, where carbimazole, methimazole and propylthiouracil are the compounds. Now these drugs, they inhibit the iodination of the tyrosyl residue in thyroglobulin, as well as they also inhibit the thyroperoxidase catalyzed oxidation process. So this is the mechanism linked with the thioureulin compounds, while carbimazole converted to its active metabolite methimazole and plasma half-life of 6 to 15 hours, while carbimazole also produces more than 90% of the inhibition of the thyroid incorporation of the iodine within a 12 hours of period. The unwanted effect associated with these drugs, they are neutropenia, agranulocytosis, skin rashes, headaches, jaundice and pain in the joints. Okay, so this is regarding the thioureulin compounds. Now in case of the treatment of hypothyroidism, where levothyroxine, liothyronine are the synthetic compound used for this condition, similar to natural hormone given through the oral route. Thyroxine, they given in the dose of 50 to 100 microgram per day, and it is used as a first line of treatment drug of choice for the hypothyroidism, while liothyronine, it is having a faster onset and shorter duration of action and mainly used clinically for acute emergencies in mixed edema coma, while the unwanted effects associated with these drugs are precipitating angina pectoris, cardiac dysarrhythmia, or sometimes even cardiac failure are also linked with these drugs. So this is regarding the treatment of hypothyroidism. Okay, so these are the references. So till date we have discussed about the overall synthesis, storage and the mechanism related with the thyroid hormone regulation and its synthesis, and we discuss about the pathophysiology of the hypothyroidism and hyperthyroidism and the other conditions. Then we have discussed about the mechanism of action of the drugs for use for the treatment of hyperthyroidism and the hypothyroidism, and we have classified all the drugs which are used for the hyper and hypothyroidism. Thank you. Please like, share and subscribe this channel, Pharmacology Insider. Thank you. You can also connect with me with this social media